So, Bonnie, absolutely honored to have you here. Whenever people reach out to me about these questions, there's so much confusion. They're trying to think about the difference between, like, what's even the difference between Social Security, Medicare, Medicaid? Just give us kind of a rundown to help us frame this conversation, even.
Absolutely, absolutely. Thank you for having me, Josh. So, Social Security is money, right? Everybody gets money deposited as long as you worked and paid into the system at a certain age. And then Medicare is insurance. People get Social Security and Medicare confused all the time,
Hmm.
but Medicare is health insurance, and Medicaid is a program designed for low income, and it helps with things like um, insurance for one thing, and with food. So Social Security is money, Medicare is health insurance, and Medicaid is a program for low income.
Yeah. And so a
Yeah.
big kind of difference that we always talk about is Medicare is trying to get you better. It's that health
Yep.
insurance.
Yep.
And Medicaid is often just trying to care for you whenever you're not going to necessarily improve, whenever you need that around the clock care and you are low income or low asseted. Why do you think there's such a confusion between Social Security and Medicare? I know we all get our paychecks throughout our whole lives. They're pulling 30% out for this kind of stuff.
Yeah.
Where does that stem from?
Well, because people don't understand what Medicare is. So, and they have an idea sometimes that Social Security takes care of everything. But Social Security is just money that you receive from paying into Social Security taxes. But another reason people would get confused whenever you get ready to enroll in Medicare, you actually go to the Social Security site to enroll in Medicare. So that's very confusing. It's like they're in bed together and one has to know what the other one is doing. But when you become Medicare eligible, it doesn't seem correct to go to ssa.org to enroll, but that's the way it is.
Well, I think even more confusing is there's different ages here, right? So when
Yeah.
does somebody need to apply for a Medicare plan?
So there's three times actually. When you're turning 65, you've got a 7 month window. That's 3 months before the month of your 65th birthday and 3 months after. If you don't enroll during that time, then you'll get a penalty. However, there are times when you can delay it. One is if you're retiring past 65. So many people are continuing to work now. It's not like it used to be. People were retiring at 55. Some people are not even retiring at 65. The rule for that, so you don't get a penalty, is one, you have to work for a company that has 20 employees or more. That's the buzzword, okay? So if you're working for a large company, you'll know that their company plan is Medicare equivalent and you don't have to worry about it. But if you're working past 65 and you have any questions about it, you can always call my office. But that's the rule. You have to have 20 employees or more. Then the other time is if you're under 65 and you're on disability. So the way that works is you have to be on disability for 2 years. And if you are, then both the medical industry and the federal government agree you're probably not going to rehabilitate. And so you are awarded Medicare.
Yeah, I think that's a good way of explaining where the 24-month penalty comes from. So many people think that as soon as they get on like disability, why can't I get coverage for 2 years? This is nuts. But I think the way you explained it, where they're really trying to make sure that this is an implementation that's going to stick. It's the kind of thing where you do have this irreversible condition. So I like that explanation.
Yeah. Let me add one thing to that. Sometimes people are sick and they go to the doctor and go to the doctor over a course of several years, but they don't apply for disability. If you can provide a past track record, then sometimes they will eliminate the entire 24-month period, okay, because you've already been sick for that long. You just didn't apply, or maybe you didn't think you were going to end up being disabled for life, okay? If you have been sick prior, people don't always go to the doctor, but as long as you have a past track record of doctor visits, okay, then there is a provision where they will let you go ahead and start and eliminate the 2-year period. But you're gonna have to prove that. And then there are a couple of diseases. Lou Gehrig's is one of them, and I can't remember the other one right off the top of my head, that immediately you qualify for Medicare. So there are some times, but they're far and few in between.
Yeah. So I would say for most of our listeners, kind of my takeaway from that was most of us should be applying whenever we're turning 65.
Correct.
If there's an issue where we're going to be working past 65, we need to reach out to your company and one of your consultants to be able to walk us through what we really need. Or if we're not 65 yet and we're trying to qualify for Medicare, it really starts to get nuanced and we should reach out then too. Right?
Correct. Yes.
And so if we kind of refocus on the people that are over 65, kind of just turning 65, can you do it in advance of turning 65 or what's the window of time to do that in?
You can enroll 3 months before your 65th birthday, but just know all plans begin on the first day of your birthday, 65th birthday month.
Perfect.
Okay.
So we can be a little proactive about it. We can
Right.
get kind of 90 days or 3 months in advance.
Correct.
But for the most part, it's going to start whenever we turn 65.
Yeah, it will start when you turn 65 unless you're under 65 and have been deemed disabled.
Okay. And so for most of the people that are listening to this, let's kind of reframe it for just that 65 and older crowd.
Okay.
If we start thinking about some of the questions I often get asked, there's like a whole alphabet of plans. You got A, B, C, F, all kinds of things. Help me navigate that. How do our listeners need to be able to think about that kind of alphabet soup?
So on your Medicare card, it's got Part A and Part B.
Mhm.
Part A is hospital, and that's inpatient. So, but it also covers not only hospital, but it covers skilled nursing and hospice. So, Part A is when you're sick and in the bed. So, it's inpatient. Part B is outpatient, and on your card, it says medical. Well, it covers things like your doctor visits, any tests that you may need, like MRIs and CAT scans, biopsies, that type of thing. Part C is just another name for a Medicare Advantage plan, which is one of two ways to get coverage. And then Part D is a prescription drug plan, but there's two ways to get Part D. You can either get a standalone Part D plan if you're enrolling in a supplement plan, or if you have an Advantage plan, it's embedded right into your plan.
I don't know how anybody would get confused by this stuff. How am I? So I want to pull you back just a little bit because I think that you have some cursory knowledge. I know you speak on this all the time.
Right.
What's the difference between a supplement plan versus the ones we're talking about right now?
So there's lots of differences. Let's take Advantage plans first. Okay. So with an Advantage plan, you may or may not have a monthly premium.
Okay, that sounds good.
With an Advantage plan, you pay co-pays or co-insurance as you go. They most reflect the same type of insurance that you have before you turn 65, like during your working years. Okay. But they have all the benefits of Part A and Part B is in an Advantage plan. And they're usually the ones that have the additional benefits like dental, vision, hearing, over the counter. Those are the pluses, and those are the things that make Advantage plans look attractive. You probably will not have a monthly premium. You get all the additional benefits. You pay as you go. So if you're not ill, okay, don't have any medical issues, you feel like, oh, wow, I got this insurance for free, basically. I mean, you always have to pay your Part B, but you don't have a premium for
So that's
this.
where the advantage comes from.
That's where the
I
advantage.
probably don't have a monthly payment that scares me. It's probably
Correct.
pretty low.
Yep.
I'm getting hearing and vision, which isn't even really covered in the other one you're going to talk about, right?
Correct.
So
Yep.
that's the plus part.
Yes.
Why do we hear such negativity? I mean, you kind of threw in there that this is good for the people that aren't sick, right? For the
Right.
people that don't need health insurance, this is a great option.
Yes.
But the whole reason we have health insurance is because we're wanting to insure against getting sick. What
Right.
happens when that happens?
Yeah. You're right. We don't get insurance because we hope something will happen. We get insurance in case something happens, right? So I just went over the pros of an Advantage plan, but let's talk about the negatives of Advantage plans. The plan itself decides on your care. and there's about 30 to 40% more required prior authorizations with Advantage Plan than if you have original Medicare.
What does that mean in real language? So this is like my doctor wants me
Okay.
to do something, but I talk to my insurance company or they talk to my insurance company, and all of a sudden they find out it's not covered, right? Is that
Well, it's not that it's not covered, it's just they decide. So let's use knee replacement, and this is something I'm making up on the fly
yeah.
here, okay? So you go to your doctor and he goes, "You need a knee replacement." And you go, "Okay." So your doctor puts in an order and requests the insurance company, because they have to do prior
Yeah.
authorization, okay, to allow you to get your knee replacement. And the insurance company may come back and say, "No, Josh, we want you to go get shots in your knee, a series of shots." So you go, "Okay, well, whatever." So you go get, I don't know, say maybe 3 shots over a period of a few months, and you still got the same nagging knee problem. So you go back to your doctor and say, "The shots didn't work. Can I get my knee replacement?" The doctor goes back to the insurance company and says, "Okay, this guy needs a knee replacement." They go, "Well, let's try physical therapy." So then you go pay copays and you get your physical therapy. And at the end, they still may or may not let you get your knee replacement. It's those type things that just sitting around before enrolling in a plan, you're not going to create these scenarios in your
Yeah.
mind, because everybody's different and God only knows what could happen next year to any of us.
Yeah.
But that's the only thing that I
So
know that's simple to add to
I think
give an
like kind of
example.
in your insurance speak, but to a regular guy like myself,
Right.
whenever you say pre-authorization, what I hear is hoops to jump through. So like with an Advantage plan, you're saying the doctor's going to need me to go do these extra, let's call them pre-treatments or things like
Right.
that. Let's see if you really need surgery from the insurance's perspective,
Yes.
even though the doctor's already said I probably need it. And that's where an Advantage plan starts to fall short. It's not that I
Yes.
can't get the surgery, it's that in order to get it, I got to jump through hoops before they're going to pay for it. Is that what I'm hearing?
Well, not only you jump through hoops, the providers jump through hoops, because they have to have somebody on the phone with the insurance companies. It does eat up their time.
What's the alternative to an Advantage plan then?
Well, there's one other thing that's a con about getting an Advantage plan. So one is the prior authorizations, and the other one is they have a provider's network. So this is really important for people to listen up. If you're on an HMO, you have to stay in the network unless your primary care doctor gives you a referral to go out of the network. If you go to a doctor who's not in their network, you get to pay the entire bill.
Oh, wow.
So it's very important for people that are on HMO Advantage plans to understand the rules.
I think one of the questions we get, just to ask it bluntly, people come in and they say, "How do I keep the doctor I've had?" Right. So
Right.
I like Dr. Smith or I like Dr. whatever. How do I make sure that I'm still working with him or her, even whenever I go on a Medicare? And so, how does that work?
Well, that brings to the other way to get coverage to offset what original Medicare doesn't. Original Medicare, if you only have that card, okay, with the A and B, that pays 80%. That leaves you owing the Part A deductible, the Part B deductible, and the other 20%. Let's go ahead and let me describe how it works if you have an Advantage plan before we move on. So in the Advantage plan has all of the benefits of Part A and Part B plus the additional ones. So instead of you paying Part A deductible, Part B deductible, and the other 20%, you just pay co-pays or co-insurance when you use your plan. Okay. So that puts that in a nice little package, right?
Yeah.
So now also, one more other thing. Also, Advantage plans have the drug plan embedded or built right into the plan.
So that's the Part D
That's
that we talk about, the drug plan,
correct.
right?
Correct. With a supplement plan, which is the other way to get coverage, remember I said they work like polar opposites? So with the supplement plan, you do have a monthly premium. That's the negative to that, okay? But think about it. Everything in life comes down to money. right?
Yeah.
I mean, when you go into a restaurant, do you automatically look at the column on the right to see how much things cost before you decide if you're going to have the salmon or the chicken, right?
Yeah.
So with a supplement plan, you do have a monthly premium. You may or may not have an annual deductible. If you became Medicare eligible before January the 1st of 2020, then you can still get a Plan F as in Frank. Okay. It's the most comprehensive, but it also costs the most. If you became Medicare eligible after January 1, 2020, then a Plan G is the most comprehensive. And it works just like an F, except there's a $240 annual deductible. Now, the federal government tells us how much that deductible is going to be each year, and it usually goes up a little. It may stay the same, but each year it usually increases some. The good thing, if you get a Plan G, though, your monthly premium is probably reduced about $80 to $100 versus a Plan F, which I call the Cadillac plan. Okay.
Yeah.
So it really makes more business sense, good business sense to do a Plan G, even if you still qualify for an F, just because of the cost of it. With a supplement plan, it gives you the flexibility to go to any provider in the United States as long as they accept Medicare. So if somebody wants to continue going to their doctor, a supplement plan, that is the way to go. Supplement plans do not have the drug plan built in, so you have to purchase a standalone drug plan. And while we're talking about Part D and the drug plans, they are the same. All the rules about them are the same, whether it's embedded in your Advantage plan or if it's a standalone plan. That's one thing. The other thing is they contract with pharmacies. So if you go to a pharmacy that they're contracted with, instead of saying in-network, they use preferred. Okay. If you go out of the network, they call it standard.
Whenever I have people coming in and they're talking about, I want the supplement, they know they want to keep their doctor, so they can't necessarily use the Advantage. They're going to a supplement and they call and say, I want the Cadillac plan. What does that mean?
That's Plan F, but you can only get Plan F if you became Medicare eligible prior to January 1, 2020. Now, Plan F is the most expensive plan, okay, because they're no longer taking younger clients into the plan. A Plan G will cost you probably about $80 to $100 less a month, and the only thing out of pocket that you will have additional would be the $240. So a Plan G reflects just like or looks just like a Plan F, except you do have the $240.
So for people that have heard about this Plan F, if they weren't over 65, in 2020,
correct,
it's not even on the table for them. It's not an option. That's an outdated kind of thing. Now we're looking at Plan G for that.
Yes.
Which you're saying is luckily a little bit cheaper. We got this kind of weird deductible that can change. Whenever we think about Plan G, what does it not cover?
Oh, it covers everything just like Plan F, except Medicare doesn't cover any cosmetic type surgeries or elective, like,
So
you can't get a facelift.
Okay. Whenever we see kind of open enrollment periods, what does that mean? Like, when can I change my plan? Like, say I didn't sign up for a G. Can I get a G later? If I signed up for an Advantage plan and I decide that I don't like it, can I switch? Give me some information about, like, how flexible is this? Is it whenever I turn 65 and I choose these options, it's locked in for the rest of my life? Or how does that work?
Yes and no. Okay. So there's always times whenever you can change. When you first become Medicare eligible, there's no underwriting. Okay. So if you want, you can get on any Medicare supplement plan that you want. No underwriting is required, and there's never any underwriting required for a plan, for an Advantage plan. If people get on an Advantage plan, you have 1 year to decide if you want to stay on your coverage, stay on that plan, or if you want to move to a supplement plan. You have that grace period that you would not have to go through medical underwriting.
So say that I'm like coming in to help my dad.
Yep.
And he's 67, and I find out that he has an Advantage plan. And we know that coming up, maybe he doesn't have the best health because my grandpa didn't have the best health.
Right.
Are there options to switch? How does he get off of that?
The only way he can get off of that is have to take drastic measures. He would have to move out of state so his Advantage plan was not available. So if he moved out of state, he would qualify for a plan N, not a G, but an N. And with a plan N, you're going to have more skin in the game. Okay, you're going to have some copays on some additional things other than the $240. Okay, so the only way he can change to a supplement plan is he would have to medically qualify, and so if he has any medical dings on his record, he wouldn't. But if he moves to another state, that does give him a one-time opportunity to change to a plan
Even that's
N.
only one time. Even with the drastic
Yeah.
measures, you can only do
Yeah.
that once.
Yeah.
So we got to make sure if we're not the ones helping our parents go through this, we're not having those critical conversations,
Right.
it could get pretty scary for us, right? I mean, it could be the thing where my understanding of the Advantage plan is even like what you talked about for like rehab or skilled nursing, it could be a reduction in benefits for that kind of stuff compared to the supplement. Is that the correct understanding?
It is, because supplements go by the rules of original Medicare. And remember, original Medicare is going to pay 80%. Your supplement's only going to pay some of the Part A or Part B deductibles and the other 20%. So if Medicare approves it, and they're the ones that have the 30 to 40% less authorizations, then if you have a supplement, yes, that you'll be able to get your care. And you're correct about the insurance company. Sometimes it's very difficult to get rehab. And then if you're on an Advantage plan and you need something like physical therapy, those visits, because we just wrote somebody yesterday and they moved into an assisted living, and the house physical therapy company, they do not contract with a single plan.
Oh wow!
So
it's all
everybody's
private pay
out.
at that level.
It's out of network or private pay. Their out of network cost is $40 a visit. Dad needs it every day of his life right now.
Wow.
So that's a huge expense. I mean, $40 a day.
$15,000 a year, easy. I mean, it's just crazy.
Well, even if he only has to have it for 1 or 2 months, that's $40 times 5 weeks times, times 5 days times 4 weeks. So
That's crazy.
it burns a hole in your pocket really fast.
So let's talk about the other side of that. Let's say that I'm involved with my dad. He turns 65. I get him set up on a good supplement plan. And then all of a sudden he sees these commercials. His phone starts ringing. I don't know how he got on these lists, but he gets 20, 30 phone calls a day of people trying to switch him over to an Advantage plan. And because Advantage is in the name and because he hasn't worked with somebody like your firm, he doesn't know any better. He says, oh, you're going to drop my copay from, $100, $120 a month, whatever, down to zero. That sounds great. I'm on a fixed income. Let me do it. Is there any way to reverse that if our parents have made that bad jump?
If you catch it, I think within the first 30 days, then you can go to the CMS, okay, or to Medicare and say, there's an agent. They talked to my father into this. He didn't understand, because usually they're not going to be so forthcoming. They're only going to tell you the goodies. Like you said, no monthly premium. And we're going to give you dental, vision, hearing, a pink Cadillac, and a trip to Disney. And I mean, that's the way they come across. And if you are on a fixed income, whether your children are helping you or not, you just automatically think, I can save money with this. And you think it's a good deal because you're
It has
trusting
Advantage
the
in the
person.
name.
It has Advantage in the name, and you're trusting the person to help you. But these calls, and I don't care if it's a call or an email, or if you get something in the mail, if somebody tells you that you are missing benefits, no, you're probably not. Those plans only apply to about 1% of everybody in the nation. Okay. They're wanting to do one or two things. Either they're wanting to change your plan, or they're using it as a ploy to get all of your information and steal your identity.
Oh, wow.
And that happens. And they'll call you up and tell you, oh, I got this plan. And they'll just make it up. Okay.
That's
some of
so
it may
scary.
some of it may be true. But, a lot of seniors, they're lonely. They want somebody to talk to.
Yeah, well, and it
And
just
it's
feels
easy to
good
fall
to
in a
think
trap.
that, you can save money. All of us are worried about cash flow whenever we're on a fixed income. And so even that extra $100 or that extra couple $100 feels like it's going to make a big difference. It feels like a wise choice
Right.
until we find out that it's not. And unfortunately, it sounds like the timelines as a caregiver or a child or even a spouse can be super short on those. So one of the questions that also comes up is, let's say that we are on a supplement plan and our health is changing. What time of the year do we need to be thinking about evaluating new Part D coverage or new supplement plans? Because they can change over time, right? We hear people that have worked with your firm that maybe had a high prescription bill because they started something new throughout the year.
Mhm.
And then whenever they work with one of your insurance agents, they're able to really reduce that because it turns from kind of a, I call it blacklisted. I don't know what the formal word is, but it's sort of an off label or some kind of weird insurance ain't going to cover it program to, hey, that's $3 now. When do they come talk to somebody like you about that stuff?
Well, every year from October the 15th until December the 7th, it's the time, if you have an Advantage plan or a supplement plan, that you can compare all the new plans that's going to be available to you the following year. So you enroll in these plans during that time frame, and all plans begin January the 1st of the following year and run through December 31st. But every year during the month of September, people get something called the annual notice of coverage. And when it comes in like a paper size, and it'll have like ANOC written really large on the top, but then it'll say annual notice of coverage. And what that does is it compares the plan you're on now with next year's plan. And it starts with like, if there's a monthly premium, the deductibles, the tier cost, or the co-pays or co-insurance, what providers are in the network, what pharmacies are in the network. So you get a nice view to compare the current plan you're on with what that plan's going to look like next year.
So even the plan itself, even if I just renew, the terms can change year to year. Is that what you're saying?
Oh, well, the terms change. Sometimes a copay may be smaller or less. Sometimes it may increase. They may have medications on this year in their formulary and they may not next year, or vice versa.
So one of the questions that I'm going to get, and I know it's always faux pas to ask this, but just being blunt to the listeners, how much do you guys charge to be able to look through that ANOC or that notice and help a family figure out what might be best?
Well, we don't read their ANOC. Okay. That's what they do. Okay. They can look at that and decide if they're happy with their plan and they just want to stay on that plan. And if you do nothing, the plan will just roll over. If you're unhappy, your needs have changed, your doctors have changed, your medications have changed, or not in the formulary or whatever, okay, then you can give us a call and we can compare all the plans against the current plan that you have.
So say that I'm helping my dad kind of navigate his ANOC. We're going line by line, and maybe it's not looking like something that's a good fit for him. How much does your firm charge to be able to help me evaluate what plans might be available for my dad?
That is a really good question. We charge nothing, okay? And the way that happens is the commission structure is already built right in. So if you call the insurance company, they just pocket that money. But if you use an outside agent, they pay the agents that
So
money.
say that I'm going through Humana or Oscar or whatever.
Yeah.
My out of month premium is going to be the same whether or not I go through your firm or
Correct.
whether or not I go through those companies directly. But the big benefit that I'm getting is kind of an advocate or somebody to help me understand all this gobbledygook.
I write so much business. I mean, I could talk to you, have just a casual conversation with you, and pretty much know based on what you need and what you're looking for, which plan to put you on. Now I get, we get information like all of your doctors, your medications, your lifestyle, what's coming up with you. Do you need a knee replacement? Okay. We take all those factors into consideration. And then I've got two different programs that I can research every plan that's available. And the reason I have two is because I'm with two different, they're called FMOs. Okay. And so one company I'm with certain insurance companies, and the other one I'm contracted with the other ones.
Yeah. So
So
rather than going directly, I can come to somebody like you and just
exactly.
have more options, but also options that are explained to me.
Exactly. So on either one of those programs, I can look at everything that's available in your service area.
So I've heard some rumors that there's a big change coming in 2025 or next
Yes.
year that I'm assuming this open enrollment is affected by. So as soon as October 15th, people could start feeling the change that's coming next year. Tell us about that.
Actually, they're going to start feeling the change when they get their annual notice of coverage, because the biggest thing to hit next year is agents can no longer write drug plans.
Oh, wow.
I know. That is huge. So the insurance companies, literally last Friday, I found out about this. It was confirmed that field agents are no longer going to be able to write drug plans. That means that everybody gets to go to Medicare.gov and choose your drug plan. I feel so sorry for every senior in America who has depended on an agent to compare all the plans and to make sure that they get put on a plan where they save money on their medications and have the least amount out of pocket.
So, like, as an advocate, as a child, as a spouse, what's our move? How do we take this knowledge and actually use it to care for somebody? Are we just out in the wind going to Medicare.gov or?
You have to go to Medicare.gov, because if you call a company, an individual company, okay, like Humana, United, Aetna, WellCare, if you call any of those companies direct, they're going to put you on a plan that they have. They've never had the ability to compare plans. That's the reason why in the past it's always been so important to talk to a broker who could compare all the plans. But now that they're not allowing us to have access to look at their plans. So if I can't look to see what's available, I can't help you.
That's crazy.
I've got two companies right now. I've got two companies. Each one of those companies have three plans. And before I came over here today, I'm only able to write two plans with one company and one plan with the other. So if you call me up, I cannot, in good faith or as your advocate, help you. I cannot write a drug plan for you. So everybody is going to have to go to Medicare.gov.
That's pretty crazy. I mean, whenever I sit across from families and I look at what they're spending on prescriptions, we aren't even going to get into the donut hole and all that kind of jibber jabber today. But it's scary to see what portion of somebody's total income is going to drug costs. We hear in the news that the government is doing things to save that for us. They're supposedly cutting down on this, but my clients aren't seeing it on their monthly bills. They're not seeing it like this. And it sounds like this move where it's almost blindfolding people, where they can't have somebody that prepares their 5 or 10 drugs that they're on to make sure that they're on the best plan. It's sort of like saying, hey, go figure it out. That's pretty scary.
It's very scary. There is good news about the donut hole. First of all, the donut hole is going away next year, finally. And this year, you could pay up to $8,000 out of pocket for drugs. Starting next year, you will only pay $2,000. That's the maximum amount, regardless of what medications you're on. So that's good news. One, they're doing away with donut hole. Two, the maximum amount out of pocket will be $2,000. The other thing that they're doing that's really important is, instead of having to pay that high deductible every year, the first time you get when you get your first fill at the pharmacy, they have created a payment plan. So what the insurance company will do is they will add up your premium if you have one, otherwise just your copays and your deductible, divided by 12, and you get to make payments each month. Now, since all this literally became knowledge to us recently, America, everybody that's on a Medicare plan in America is not going to know either. So
Well,
they're
it's pretty
allowing.
scary to think that this isn't news, right? Like, this isn't hitting anybody's story. This isn't hitting anybody's headlines. And this seems like it's a pretty major change.
It has, but you don't, but they're not making it big and flashy and it's really out there. You have to look for it.
Yeah.
So you can also join the payment plan any month because trust me, seniors in America they're not going to know about this in January. Some of them not going to know about it in February. They're not going to know about it until they go get their first fill for their medication. But then they can, divvy it up into monthly payments based on that time frame. So that's good.
Well, those are some huge changes, Bonnie. I appreciate you being here and sharing all this wealth of knowledge for us. I think that our listeners have gotten something out of it as far as how they be an advocate for themselves or somebody that they're caring for. If people want to find more or reach out, where do they get in contact with you?
They can call me at my office and the number 770-373-7541 and we can help them navigate through this.
All right, perfect. So, Bonnie, I keep hearing these kind of rumblings that things are going to change pretty drastically in 2025. What's coming down the pipeline?
There's two things that are coming down the pike. One, we are not going to be able to write drug plans. Okay. We're not even going to have access to look and compare. So therefore, we could not help somebody do that. Everybody will have to go to Medicare.gov and figure it out for themselves. Number two, with the Advantage plans, many of those plans are going to be exiting, meaning the end of the year, those plans will be terminated. It's not one company, there's three major companies that will be doing this. So if you're on one of those plans, you're going to be forced to change your Advantage plan. This is going to really create a nightmare for us as agents because we're going to have to go back and rewrite business for clients that we already have. And even though you may be happy with your plan, and if you don't do anything, it'll just roll over. But now you're going to have your plan rewritten.
So we talk a lot about supplements and how for a lot of people that's a better option. But if somebody is locked into an Advantage plan, they're not willing to do the crazy stuff like move out of state to get rid of it. Especially with this kind of change, it's still really important that they would come and talk with your team to make sure that they're taken care of in 2025, even on an Advantage plan.
That's correct. So just know if you're on a drug plan, you need to go to Medicare.gov and check it out yourself. If you're on an Advantage plan, you need to give us a call at my office so we can find out if you're on one of those plans that is going to be terminating.
So, Bonnie, I'll tell you that Medicare for most people is pretty confusing, even if we get the understanding that it's just healthcare for people that are over 65 and we just focus on that group. It still feels like it's alphabet soup to most people I talk to. Can you walk me through that?
Absolutely. So there's 4 parts, A, B, C, D. A is hospital. It covers you when you're in the hospital, it covers skilled nursing, and it covers hospital. So A is when you're sick and in the bed. B is outpatient. So that covers your doctors, your physical therapies, your test. Your tests like MRIs.
Like imaging and things like that.
Exactly, those type things. Part C is just another name for a Medicare Advantage plan, which is one of 2 ways to get coverage. And Part D is a prescription drug plan. And you can get those prescription drug plans one of 2 ways, either as a standalone plan if you have a supplement, or if you have an Advantage plan, it's embedded or it's built right into your plan.
Perfect. So, Bonnie, thank you for being here today. It's absolutely educational for me. I completely understand how you're just renowned in our senior industry for being a public speaker on Medicare insurance issues. I know you write articles for the AJC.
Right.
But it's a lot for people to digest. If we needed to narrow it down to just 3 points, here's the most impactful things that you need to take away from our talk today. What are those?
There's so many changes for next year. Number 1, agents are not going to be able to write your drug plan, so you're going to have to go to Medicare.gov and write your own drug plan. Many of the Advantage plans will be exiting the program. So if you're on one of those plans, you're going to have to change plans. And if you need help navigating any of this, you can call my office. We are brokers. We can compare every plan that's available to you. And our number is 770-373 7541, and the name of my company is Insurance and Other Red Tape, and my name is Bonnie Dobbs.
Thanks so much, Bonnie. We're really blessed to have you today.
Thank you, Josh, for having me.